Joining us now to discuss vaccine mandates is Dr. Zain Chagla. He's an infectious diseases physician at St. Joseph's Healthcare in Hamilton and also an associate professor at McMaster University. Dr. Chagla, thanks for joining us.
Thanks for having me.
Let's start with, you have long been saying that vaccine mandates, the federal mandates, no longer make any sense. Why do you make that argument?
Yeah, these mandates, particularly as they deal with travel on trains and planes, the intent of these was to make sure that people on an aircraft or on a train would have lower risk of having COVID transmission or having COVID at the time. When these vaccines first came out, I think we had reasonable data to suggest with Alpha and Delta that the protection against symptomatic infection was actually quite high, in the sense that if you had an entire vessel full of people that are vaccinated, the probability of someone having COVID is much lower. With Omicron, things changed significantly, and we do know that vaccine efficacy has waned, that 2 doses of vaccines really doesn't provide that much symptomatic benefit, especially 20 weeks after that second dose, that 3 doses of vaccines may restore some of that efficacy. But even then, data from the United Kingdom suggests over time that wanes down. And at 20 plus weeks, the last estimates are 0 to 15% efficacy against symptomatic disease. And I think when you put that all together, when you go on a flight and you're sitting beside someone, you have no clue whether or not they're 2-dose vaccinated, 1-dose Johnson & Johnson vaccinated, 3-dose vaccinated, but 20 plus weeks ago. And so, you're really not necessarily reducing the risk in those contexts as compared to an unvaccinated person. I think once that fundamental argument breaks down, you really have to start talking about what is being taken away from individuals that isn't offering protection, that individuals that haven't chosen to get a vaccine, aren't able to travel when their risk, especially as many of them have had COVID at some point, really, doesn't change as compared to a vaccinated person with 2 doses or even a vaccinated person with 3 doses. That argument starts breaking down significantly.
Well, the interesting thing, though, is we just saw a briefing from the Canada Public Health Agency, and Dr. Theresa Tam made the argument, though, that even although it's not significant, she does talk about the third dose, people who are third dosed, that there is between a 40 and 50% efficacy, she says. So there is some protection is better than none. And that was one of the arguments she made for continuing on with the vaccine mandate. She also made the argument of possible variants internationally. How do you respond to that?
Yeah, absolutely. Look, I'm not here to argue. The vaccines have incredible effects against people getting very ill with COVID. I think everyone should be getting their full vaccine series, and that's important. But, again, that 30 to 40% data comes from studies looking at big populations. And so some of those people in the populations may be very early in that vaccine third dose series. Some of those may be late. And when you balance all of those odds out, you start seeing 30 to 40%. The eventuality, though, in the UK, which is really tracking this data appropriately over time since that last dose, is really showing that as time progresses, things keep getting lower and lower and lower. And again, the mandate for travel is not 3 doses of vaccine. It is 2 doses of vaccine or 1 dose of a Johnson & Johnson vaccine. And so, again, who is actually on an airplane may not be someone that's optimally third dose that may have some protection against symptomatic disease. It could be 2 doses, it could be 1 dose. And recognizing that, I think, again, breaks down many of those arguments in terms of using it as a way of protecting that aircraft.
What about the other argument, and this did come up from Dr. Theresa Tam, and that is there is a hesitancy to take away vaccine mandates because, as you probably have witnessed, people aren't getting vaccinated anymore. And if there's absolutely no incentive anywhere in any human activity to have a vaccine, people are just going to abandon the efforts to get vaccinated.
I mean, again, outside of healthcare and federal restrictions, there really isn't a mandate to get vaccinated to do much. I will say, on November 30th, when vaccination was the only way to get on a vessel in Canada outside of medical exemptions, to, even up to a month ago when I last checked this, we're seeing vaccination, like primary first dose of vaccinations, only going up 2 to 3% in the adult population and really, really flattening out over the last 2 months. And so, again, it isn't meant to be a policy to incentivize people to get vaccinated. That's a positive medical decision that goes on with the provider. But at the same time, I don't think we're even getting that in all of this. And again, we're getting much more division. much more divisiveness, recognizing that, people have access to alternate vaccines, people have access to treatment now. Many of the unvaccinated individuals have had COVID, and the risk of subsequent serious disease has been significantly limited. All of this plays a role in how we interpret this in this modern age.
Okay, the accompanying question, though, must be asked then. If you're saying that it's counterproductive, it's not necessary to have vaccination for travel purposes, masking, would you then say, because we talk about layers of protection, if you're going to have a hodgepodge of people who are vaccinated and not on a plane, would it be, in your opinion, absolutely essential to have mandatory masking on planes and in places like public transit?
Yeah, look, I think, masking is an easier intervention. I think if we're going to make changes, again, allowing everyone to travel is probably the biggest thing. And then, looking at data from jurisdictions that have dropped masking in airplanes and seeing if there's been a rise in transmission associated with that. So, everything does need to be examined. Right now, I think masking on planes is reasonable, although, again, when the plane's in air, when planes are actually moving, people are taking off their masks constantly. There's adequate ventilation when things are moving and when the ventilation systems are on. And so masking may be, one of these things that can be used in certain settings like the airport, but not necessarily when things are in the air and the ventilation systems are running, better than, most operating routes in the country.
Okay, last question in just one word. Do you think we will see, there's a decision has to be made about July 1st at the end of June, whether the Canada Public Health Agency will maintain this regulation on vaccination for travelers? Do you think we'll see it lifted or maintained?
I hope they lift it. This is affecting people in their real lives, right? People can't fly to see a funeral. People can't fly to see their families. I think we have to take this into account. And many international jurisdictions around the world are dropping these mandates for vaccination. I think we have to follow suit. Okay, Dr. Chagla, thank you very much for speaking with us.
No problem. All the best.